Hantavirus. For most people, it sounds like the name of a forgotten disease from a medical textbook. Something rare, something distant. But in 2026, that illusion has shattered. Right now, health agencies across the world are closely monitoring one of the most unusual hantavirus outbreaks ever recorded. A multi-country cluster linked to an international cruise ship. The outbreak has already caused multiple deaths, triggered quarantines across several nations, and reignited fears about how dangerous this virus can become under the right conditions. To understand why experts are suddenly alarmed again, you first need to understand what hantavirus actually is.
Let's talk about hantavirus.
Hantaviruses are a family of viruses mainly carried by rodents. Humans usually become infected after inhaling tiny particles from rodent urine, saliva, or droppings. In the Americas, hantavirus can cause a devastating illness known as Hantavirus pulmonary syndrome, or HPS. The disease often begins like the flu: fever, fatigue, headaches, muscle pain. But within days, some patients suddenly struggle to breathe as their lungs fill with fluid. And when that happens, survival becomes uncertain. Some strains have fatality rates approaching 40 to 50%. For years, hantavirus remained relatively obscure because outbreaks were usually isolated and tied to rural exposure: campers, farmers, people cleaning abandoned buildings. The virus rarely made international headlines, but the latest developments are different. In May 2026, the World Health Organization confirmed an international hantavirus cluster connected to the Dutch expedition cruise ship MV Hantavirus. Passengers from multiple countries became infected after traveling through parts of South America, particularly Argentina and Chile, where the Andes strain of hantavirus circulates naturally. At least several passengers became seriously ill. Multiple deaths were reported. Countries across Europe and North America began tracing contacts and monitoring travelers. Some passengers were flown to specialized quarantine facilities. What makes this outbreak especially disturbing is the strain involved. Most hantaviruses do not spread efficiently between humans. But the Andes virus is different. It is one of the only known hantavirus strains capable of person-to-person transmission. That fact alone transformed the outbreak from a regional health issue into an international concern. Now health officials are emphasizing that this is not another COVID-style event. The virus does not spread nearly as easily. Transmission generally requires prolonged close contact, especially after symptoms appear. Still, the outbreak has exposed weaknesses in global preparedness for rare but deadly diseases. And experts are asking uncomfortable questions. Why are hantavirus cases rising in parts of South America? Why are outbreaks appearing in new environments? And are climate and environmental changes making the situation worse? Researchers increasingly believe the answer is yes. Rodent populations are heavily influenced by climate patterns. Periods of drought followed by heavy rainfall can suddenly increase food availability, causing rodent populations to explode. More rodents means more viral exposure. Add deforestation, urban expansion, wildfires, and human encroachment into wildlife habitats, and you create more opportunities for humans to encounter infected animals. Argentina has already reported a significant increase in hantavirus activity compared to previous years. Authorities there recently announced expanded rodent testing programs after case numbers surged sharply over the past year. At the same time, scientists are warning about another major problem. There are still no approved specific treatments for hantavirus infection. No universally available vaccine. No guaranteed cure. Doctors mainly rely on supportive care, oxygen therapy, intensive care support, and mechanical ventilation if breathing fails. Early detection can improve survival, but once severe lung involvement begins, treatment becomes extremely difficult. The current outbreak has also revealed how fragile international outbreak coordination can become during periods of political tension and funding cuts. Meanwhile, the World Health Organization and multiple countries are now updating guidance for hantavirus monitoring, quarantine procedures, and international contact tracing. Experts are effectively rewriting parts of the outbreak response playbook in real time because a ship-borne hantavirus cluster of this scale had never really been documented before. And that may be the biggest takeaway from all of this. Hantavirus is still considered rare, but rare diseases can become global headlines very quickly when environmental change, international travel, and human transmission intersect. The virus is not new. What is changing is the world around it. Warmer climates, expanding cities, disturbed ecosystems, global mobility. All of these factors increase the odds that diseases once confined to remote regions suddenly appear on the international stage. For now, health officials insist the broader public risk remains low. But the outbreak aboard the MV Hantavirus has become a warning sign, not necessarily of a pandemic, but of how vulnerable modern systems remain to emerging infectious threats that most people barely even know exist. And somewhere, in forests, fields, abandoned buildings, and rodent nests across the world, the virus is still there, waiting for the next opportunity